Welcome back to this We're All in This Together edition of Yankee Chronicle. I'm your host, Abby Peel. With the COVID-19 pandemic among us, one of the most important institutions in the middle of efforts are hospitals. Let's now join Elizabeth at our New London Hospital and hear of the efforts on their behalf.
Welcome to New London Hospital. I'm Elizabeth Gerazio, and we're joined by Tom Manion, the president and CEO here, and we're talking about the present state of affairs here and how COVID has affected the daily operations. Thank you for joining us.
Thank you.
Now, the entire state and the entire nation has really been racked by the COVID-19 pandemic. Tell us a little bit about some of the things that have happened at New London Hospital as a result of this illness.
Sure. So first and foremost, when I think I started on March 9th and March 11th, the WHO declared COVID a pandemic. So getting my feet on the ground and really to get a sense of what we needed to do, one of the first things we did was we stood up an incident command team to be able to look at how do we safely take care of our patients, our staff, making sure that we're putting all the right protocols into place. And so that had a lot of other downstream effects to make sure we're taking care of everyone safely. One of the things that was probably most significant is we had to close our ORs. Closing the ORs was important because there are a lot of things from making sure you have the proper personal protective equipment to how are we going to make sure people are in the OR are going to be, in case someone has to be intubated, which aerosolizes everything in their lungs. How are we going to make sure that people are safe? So there are a lot of things that we just had to get protocols in place. Today we have those in place, so we do feel very comfortable and confident that we're able to safely take care of and sterilize everything that needs to be cleaned in our ORs. But that took a long time for us to get that stood back up. The second probably largest thing was we had to delay our Epic go live, and Epic is our medical record, electronic medical record that Dartmouth-Hitchcock uses, and it's a integrated system that will actually create one instance of your medical record if you go to Dartmouth or here, and frankly, any other Epic shop where their Epic has a lot of interoperability to push and pull data so we can have everything right in front of the provider when they see you. And obviously, those are kind of the direct impacts here, but the other huge thing is our patients who had time-sensitive care that is, quote, elective, but is still really important for them, whether it's getting a cataract removed or something like that is really affecting your personal life and what you need to do to take care of yourself. So we have moved forward. Epic has a new go-live date in October. Our ORs have been up and running, and we are full throttle ahead. So those are the biggest things.
Even for me to come here just in this room, I had to be screened. We all have masks on. You might not be able to see this through the magic of television, but we're significantly far apart from each other. Like he's like way over there. But other things about coming to a hospital, a lot of people right now, and I know the CDC and our government leaders are very concerned with the fact that people are putting off elective items that need to be done. And the concern is that a hospital has germs. Tell us a little bit about some of the things that you're doing here. I mean, I've seen on the way in, but that can allay those people's fears that this place is clean. Right,
great question. And so we are probably one of the cleanest places in New London, arguably, in the country, I would say. We've had such a low incidence of COVID here in our community, very low in this hospital. I can count on one hand. And so we have taken steps from screening where you get asked certain questions. We take temperatures. We give you masks if you don't have one. If you're in this building, you have to wear a mask. That is just part of how we're going to operate. Masking has a huge level of protection, not just for you wearing the mask to not breathe in something else, but for everyone else so that what you're breathing out is contained in your mask. So if everyone is masking, we're going to see a much lower in community spread. So those are probably some of the larger things that we're doing, but we're also going around, we're cleaning all the surfaces multiple times a day. Our waiting rooms, all of our seats are much further apart. We've actually taken out most of the chairs from our waiting rooms in order to get that social distancing right.
So you can't accidentally get too close.
Right, exactly. And then the other thing, if you, and I can say I had a primary care appointment yesterday, so I have the full end user experience that when you go in and you check in and you sit in the waiting room, you are there for a matter of seconds before someone comes and takes you out of that waiting room and puts you into an exam room. So you are not in a community setting around other patients for very long at all. Also, if you do have any of those respiratory or other symptoms that are potentially COVID, we do have a separate location where we take those patients, so it isn't for your general primary care visits. We have a separate respiratory clinic that will take you to and treat and screen you to make sure we aren't having those patients also go up to people who are getting annual physicals or checking in on their hypertension or chronic other diseases. So it's one of the biggest things we're trying to ask our patients: please don't put off your care. Take care of yourself. Some of those things that are, if you delay that care, you might not see it right away in terms of the negative side effects, but years down the road, because you haven't taken care of your hypertension or your kidney disease or things like that, we could see some significant issues arise downstream.
Sure. Well, thank you, Tom, very much for joining us, and you heard them. This hospital is taking every precaution to make sure that it is safe for you to continue your care here. So if you've been putting off an elective procedure or testing or even an annual physical, make sure that you contact your primary care provider and your doctors to make sure you get the care you need, because New London Hospital is responsibly taking care of you.
Thank you, Elizabeth and Tom. Next week, we'll hear of this vision for the future of the hospital. Next up, I'll join Jeremy Stout at LaValleys to hear about how they support communities that they serve. Please stay with us for the messages from the other businesses that support your Yankee Chronicle.